ensure that the percentages start getting back towards the 90%. You'll see that in the report that we said that we project that this will carry on improving month by month as we do both work in those areas. To align with that, the other one, which is the DP11S, our assessment work, which is when we get new claims in, we will try and do that as quickly as possible. Again, the key area here has been the changes that we've implemented within this section, which is bringing in new, and again, I apologise, there are acronyms here, SAO, Senior Assessment Officers. These are new staff that have to be brought into our section, who have come from basically other areas of the authority to start implementing a different way of assessing quickly to get the bills out, which gives us a better chance of collecting with better information and more time to actually collect money. And again, this is which we will now see starting in September. They are in, as we put in this report, they need to be trained in this area. They then need to get out there and work with people who are looking for these additional care assessments. And both of these effectively should improve as we go on with our staff and training to be able to implement these new areas of work. I'm taking questions, Jim.
You talk about clearing historic debt, which you say is very difficult to recover. If the focus is on going after the very hard to recover, the danger is that the current and the accruing by default turns into historic. I'd like to know what the balance is and the risk of, when you call it a day, so you're chasing the right thing.
Yes, we are doing both. We are very conscious with all of our hats on with regards to debt recovery as to within 12 months is the most key time to recover any debt. But we clearly have a position where we have to try and look at historic debt. We have a number of initiatives going on, looking at how we can take more legal action. We are working with head of legal services, looking at how that can be improved, to try and make sure that those are done quickly, as well as looking at all the historic debt as to what we can take action to see recovery on, or actually get to a position where we can declare that we are not going to get this money in and we'll have to go to write-off. It is down to us to try and balance our resources to make sure that we don't miss out the current people, because once you've got people paying and are regular at paying, it is less likely that they will actually default, and that's probably true. Most debts against trying to build a backlog that we have with recovery debts, so we do try and balance that.
Yeah, just one more. We're talking about 5% away from the end of year target, 10% in the what's that in pounds and pence, because that then quantifies to us the risk involved?
Effectively, the assessment one, DP11A, isn't actually a cash one because it's just how many days. The key one, DP11 percentage recovery, total performance PFU debts at a current time of about £30 million. So we collected 54%. Trying to do my maths.
5% is 1.5 million.
About 1.5, yeah, just about 1.5 million. And that is obviously if we get to the 5%, you can work out if we miss by 10%, it's still
Can I just kind of follow on from Mark's first question? If you pursue a debt, a historic debt, and it, say debt's raised by 2007, so presumably each year, like 2007 and 2008. So when the debt is so historic, although you've been pursuing it, that it reaches the time, what happens? Do you just have to then call it off?
Effectively, if you've got people paying arrangements, and arrangements are in place, you can keep collecting the money. Where you have not taken recovery action, well, when it's 6 years plus the current, that is effectively the debt statute. So people who have got arrangements in place, and this is true not just on PFP but in all debt, they can keep paying. But if we haven't taken action, we can't show what we've done, we can't have to commence recovery action through the courts for a debt that's more than 6 years plus the current.
So if you are actually actively trying to recover the debt, you can go over 6 years.
Effectively, yes.
I just want to be clear what happens
we are working with our colleagues in adult social services that when social workers do make contact with people, that they make it clear that there can be a liability to pay if people will access that kind of service. It's then for our senior assessment officers to go out and try and quickly quantify where that will be at a cost. So it is important for us to work with adult social services staff when they go out so that we always make sure that when we can tell you that there's going to be some liability, you will be expected to pay. Again, apologies, isn't that it should be in the collection and recovery team. It's the team that we set up to look at both the historic debt and ongoing work to make sure that we put new policies and procedures in to how we get the money in. It is led from within our division, but they are staff that have been placed in there to try and focus on this particular situation, to try and make sure we recover as soon and as much as possible.
Is that an interim arrangement or is that like now?
At the moment it is an interim, they've been seconded into that team. Again, we will make a decision as to what of that team remains in place. Clearly, once we've cleared the historic debts, there isn't a need to keep them, hopefully, that they've become historic, but there is clearly a need to have some additional work done with regards to what I would term recovery enforcement. We will look and then make suggestions and proposals to how we can elements of that team to do additional recovery work.
Mine's just an extension on what Phil said. Because I work for agent care, I've got, the care assessments of people going out and doing financial assessments. And I think it really is, I agree with that. It's good to go out and do financial assessments, explain to people exactly what they owe. An awful lot of people who are impressed by care do not realise that they have to pay a bill and don't understand why. So I think within this there has to be training, there has to be some sort of underpinning of that. We need to explain to people exactly what they're paying for and exactly what their responsibilities will be to pay for. And I think it will not to get the same mess again in the future. It's part of it.
Totally agree, which is why our staff are being trained to try and make sure we can highlight that not just to the people who receive the care, but in many cases including their families and relatives who are the key ones that we will address to them. Actually, even if the person who gets that care service, we are very conscious of that need to have our staff training.
I know this is going to sound really obvious, but can we make sure that the paperwork that people get is readable? Because an awful lot of the billing system is very, very difficult to understand, so it needs to be a little bit clearer understanding than we actually.
Again, through the chair, it's fully accepted that we need clarity in all of our billing as to how much you owe and what will happen to the okay. Yes, we can't do that.
Any further questions? Okay, I'll take Phil and I'll ask any more questions then.
I have a question on the rest of why the rest of
Yeah, right, we'll take that after. In terms of DP11 and DP11A, to the first question, for data sources, for the assessments we've got Civica being listed as the data source, and the recovery is Oracle. So finding in terms of using two systems there, is there anything that's getting lost between the two, or is there efficiencies to be gained by maybe doing both to one?
Currently, no, there isn't anything that is lost between them. The Oracle system is effectively, some of the debtor system is the accounts receivable system, it's where the debts are. The assessments are actually done via the Civica document management system, so we don't work with 30 pages of paper, we're looking at it on document management. It is very similar to the way we actually would work, particularly in, say, housing benefits. We use both. We use the academy system, which is basically the calculating system. We use Civica, which is the pieces of paper with the application on. So no, there shouldn't be any loss between the two, and our staff should be able to work with both, which is why people have been to our division. We work with you with screens because one's on the screen effectively is how they work. So it is two systems, and no, there shouldn't be any loss between them.
Do you think there'd be efficiency savings if we just use the one? Because I'm feeling both input information
to an earlier report that Tony Lee presented, that there is a review as to the adult social services systems in the future, and part of that review will include our staff ensuring what is then going to be done with regards to such charges. If there is a benefit, financial and service-led, we'll look at what the options are in the future. Equally, we know we already have a permanent bus system that's available to us, and that would be something that will be taken part in that very large system review. Obviously, this bit forms only a small part of it.
Okay, thank you, Mark. Right, in terms of DP11, I'm just wondering if because of the issues with historic desk, our group funds is I think getting matched somehow. And I'm just wondering if there's a bid to be matched. I'm just wondering if there's an argument for maybe separating the two and have create a separate measure for the historic desk and one for the current desk, so we can monitor group funds and the historic desk maybe set a realistic size.
I would agree, Chair. When we set this up, it's the first time that we implemented a specific PFU recovery module. We're working with the head of business management from GAS, and it is likely that we look as to what next year's basic PI should be, as to whether or not we should split that, and that may be a better one for us to look at, as how we're working on historic debt, whether we are actually doing anything with that, and how we are doing in the current situation, which is something again we tend to use in other debt recovery areas as to how we deal with the current, how we deal with the, if you like, the older debt. So that is something we can look at for next year.
Okay, further questions? Right, thank you, Mark. Oh, sorry.
No, sorry.
Okay. Thank you, Mark. Okay, I'll open the floor for any questions, comments for the rest of the course. That's good. Just trying to get reference to CP5, there's no colour attached to it. But this is quite important part of information. It's a huge saving we're trying to achieve. There's no information available. And yet when you read the subtext, it says information on agency spend is available through the People Management Information Monthly Reports and sent to the Chief Executive. I'm not sure why that information hasn't been gathered for us. So I would say that's a HR issue. And then just going back to CP3 as well, it seems that important information isn't being given to us again because there's a lack of HR information. I'm not sure it's fair for the accountable officer to be the only accountable officer in that box. I think we need to say to HR, like, when you're going to have that information ready for us. And then just flicking over the page to the kind of response to why that information, reads inconsistency in Delta Hay held by different teams. What did I want to bring? I can't even pronounce that word. Basically means the council's ability to effectively monitor the outcome of savings, and that's our biggest area of savings. What we've had to do in terms of reducing staff, we can't monitor. There's something going on in HR that is completely unacceptable. I used to sit on the employment appointments panel, and we authorised extra spend because they needed extra resources. We held off hearing report after report on the new IT system that was going to sort all these issues out. And it seems that a fairly large gap in our information there, and I'd just like to hear, are they fair comments in the first place? Maybe we completely overstep the mark. But if there is an issue, what is it and when will it be sorted out by? Because it seems like there's 3 or 4 significant savings areas that maybe aren't on track and we don't know about that. And then that further links into reports later on where there's real confidence given about where departments are in terms of savings. But I don't know how that information is gathered without these big chunks of information being available.
Chair, thank you. I think absolutely valid comments, Mark. Certainly happy to accept those as issues to take up. In terms of CP3, I think we covered it in some parts in terms of Jim's response in regard to the establishment, linking very much to the financial element, and you're absolutely right. In order to bring heavily into this, it was important piece of work to be taken. In terms of have consultants in place for specific time-limited projects. We have consultancies in place, particularly for big major capital programs. But I think what we're concerned about is whether consultants are being used either instead or additional to existing workforce. And I can't give you confirmation sure that would be reduced, but we're more than happy to provide the information to committee members if that would be appropriate.
I've got a separate issue, it's P7 research. It says in the comment section, the committee meeting in September is to be cancelled as requested by the chair. I just wondered why the standards of constitution oversight committee have been cancelled.
As to what?
P7 says standards and constitution oversight committee recommends changes and revisions to council. And the September committee meeting is to be cancelled as requested by the chair. I just wondered why that meeting was being cancelled.
The chair was fortunately available for the September meeting, and having discussed the matter with him, was of the view that issues that could have gone to the September will be capable of being dealt with at